My name is Laura Landworth. I'm the President and CEO of LeadingAge Colorado. It's my pleasure to welcome Augustana Care to Colorado, and I'd like to thank you for giving me some time to tell you a little bit about our association. We have 3 national affiliates: LeadingAge, the Assisted Living Federation of America, and also NADSA, which is the National Adult Day Service Association. Our membership overall is about 250 strong, and those 250 members serve about 50,000 clients in Colorado. Our membership is about 54% nonprofit and 46% for-profit. Our for-profit members are primarily assisted living providers due to our Alpha affiliation, as well as our business partner members. About 40% of our membership is assisted living, that's the biggest part, followed by 25% who are independent housing, another 15% are nursing homes, and the remaining 20% is split pretty evenly between home and community-based providers, including the PACE program. We have 3 in Colorado, and then the other half of that is about primarily our business partner members. In terms of our board, we allow for 15 members on our board of directors, and the composition pretty much reflects that membership composition which I just described. Our primary initiatives are to develop the future leaders of our association, and we actually started an initiative several years ago. It's now called Leadership Next, and we have a planning committee that meets regularly, and they really help to determine how that initiative is going to evolve over time. It's been very successful for us. The other area that we really would consider a major initiative is looking at quality issues. Certainly you're familiar with the Quality First initiative, which LeadingAge started several years ago. We still have that type of a program and focus, but we're looking at how we can maybe update that and evolve that, which is what LeadingAge is also doing. I'm sure you're probably aware of that. In terms of our office, we do actually have a physical location in downtown Denver, just a few blocks away from our state capitol, but we still refer to our office as sort of a virtual approach. There's 2 full-time staff in the office. I'm one of them. The other one is our Director of Operations. Her name is Karen Simmering. In addition to the 2 of us, we have very many consultants which we use. We follow this approach because we find with the variety of members we have, it's not possible for us to have full-time staff with expertise in all of those different areas we need in order to be a good resource to our members. So we do employ different consultants. For example, right now we have an affordable housing consultant who's particularly well-versed in HUD regulations. We also have a consultant who's working with us for a specific task to look at how we can update our state's Medicaid regulations for adult day providers in Colorado. We also have lobbyists that are consultants for us, a PR firm, legal services, a meeting planner, a whole myriad of people who really help us and are typical to the kind of people you would find in a full staffed association, the more traditional approach. In terms of our areas of focus, I wanted to tell you just about 3. Our members tell us year after year the primary reason they join is for advocacy. So certainly that's where I spend the majority of my time. We have a legislature that meets annually every year from January through May, and in fact they're still meeting right now. They will end their session next week. We also spend a lot of time with our state agencies who have regulations that impact our members. That's primarily our state survey agency, which in Colorado is the Department of Public Health and Environment. It's also our state Medicaid agency, which in Colorado is the Department of Healthcare Policy and Financing. Another area of focus for our members, just like you have in Minnesota, is education. We don't do as many conferences as you have there. We have one big annual convention each year, and in fact that conference is coming up the week after next, so we've been very busy getting ready for it. We also like to provide regular information for our members through various email communications. We also started a couple of years ago a private communication platform. It works sort of like a Facebook platform, but it's private, so only our members are part of it and interact on it. And we chose to start that communication approach because our board felt that it was important that we help members understand how to use that type of communication platform. It's getting more popular over time. We've got a ways to go with it, but we do think it's been a great approach, and members who use it have found it to be a fun way to get to meet new members and to share issues and concerns and to learn from each other, frankly. I like to think of it as sort of our 24/7 interest group opportunity. You can post a message at any time, and those who see it can respond. The other area that I mentioned about Leadership Next in terms of education, they have a group who plans their own events, and they have great events each year, usually 4 or 5 events, and they try to focus on leadership types of topics, but they also sometimes do just fun networking events. One year we went to a bowling alley and we had a great time. But again, that group has really been a way to try and engage our future leaders. It started out as an approach to engage more younger members of the association, but it's really geared towards anyone who's new to our industry. In terms of hot buttons, we really have 3 areas that are primary issues on which we're focusing these days. Just like in Minnesota, we're trying to figure out healthcare reform and what can we do to help members be successful under whatever changes come about because of the healthcare reform law. What we are looking at is we're looking at the issue in terms of our members as providers, as employers, and also looking at the clients they serve and how they help to educate their clients, their residents, so that they understand what changes are taking place because of the healthcare reform law. We've not worked out any particular initiatives so far, but we are offering education programs. Another area is our state budget. Just like all the states around the land, we've had budget cuts that have impacted our providers. In fact, I looked up what's happened since the economic downturn began, and we've had a 6% reduction in Medicaid provider payments for our community providers that participate in the Medicaid waiver programs, but we've had an 8% reduction in nursing home payments, and that's just in the last 2 years alone. So I'm sure you've seen similar kinds of reductions in your state as well. I'll talk a little bit about some of the opportunities, though, that those budget constraints have actually afforded us. The last area, which has come up in this session, it's come up in prior legislative sessions, is should we fold long-term care services into Medicaid managed care? So far, our position has not been to support that legislation, and we do believe that bill, which is still active in our session, will not pass again this year. Our board did develop a position paper on Medicaid managed care, but so far none of the bills that have put forth have looked like how we would like to see that occur. So we will continue to see that issue come up, I think, in future years, and we'll continue to work with our legislators to educate them about an appropriate way to pursue that, at least as we see how it should be done. In terms of those opportunities that come out of the challenges faced by the budget constraints, let me just close and give you a few specific examples that impact our members where we've tried to take advantage of the interest and how can we be more efficient because we don't have as much money available. For the first time with assisted living, we found our Department of Health is very interested in looking at an abbreviated survey process for assisted living providers. This would allow them to focus their more scarce resources with their surveyors on the repeat poor performers. Most of the providers in Colorado aren't in that category. Again, the department agrees that this will be a way probably to focus their resources. So we find that to be a positive thing that's come out of the budget constraints. Another thing that we found is that last year in our legislature, we actually helped draft a bill that was passed that would require a state Medicaid agency to fund another way of paying assisted living in our Medicaid waiver. We currently have a flat rate system, and we successfully made the case that if you have one rate, as a resident's needs change and becomes more complex, that tends to mean that person will be discharged to a nursing home under Medicaid. And that's really not the best use of public funds because they generally don't need to live in that setting. They just can't stay in the lower cost setting. That study actually has been funded, and there's a contract, and a research study has just gotten underway, and we expect to have those results in 4 to 5 months. So we hope that a year from now, in our next legislative session, that we will be looking at a change in how we pay assisted living providers. And that really came out of the whole idea of how can we make the most efficient use of public funds. With nursing homes, we found that we've opened the door for the discussion of deemed status in terms of their survey process. That never would have happened prior to the economic downturn, where it seems there were more surveyors than staff at the nursing homes when they go out to do their surveys. So that's been a positive change. Another change is we've been able to get our Department of Health to agree to a moratorium on any increases in licensure fees. Again, that's the sort of thing that we wouldn't have gotten any interest in discussing, much less a commitment to not increase fees just a few short years ago. The last one I would mention is with our adult day members. I mentioned we hired a consultant who is helping us with updating regulations. That actually was in the same bill that we helped write last year, which passed to look at assisted living rates. We also made the case that in adult day environments in Colorado, if they would allow a secure or restricted environment with the use of keypad access or other mechanisms, that when they had clients who started to develop wandering behavior, they would still be able to be at that adult day program and in a secure and safe environment. Right now, what we see happening is family members end up not letting their loved one live with them anymore because they don't have the adult day program to take them to during the work week. And oftentimes those individuals again end up in a nursing home when they don't need that level of care. So that's just a few examples in terms of the issues, the challenges, and the opportunities that we've tried to pursue in these times of budget constraints. I really appreciate the opportunity to tell you a little bit about LeadingAge Colorado and about how we're organized and how we operate. We really look forward to working with you and look forward to meeting many of you, we hope, in the future. And we encourage you to not hesitate to contact us at our office if we can be of any assistance to you. Thank you.